You can do everything right. Eat well, stay active, go to every appointment, and still end up in a medical situation you never actually needed. And the scary part? It usually begins with one completely innocent sentence from a well-meaning doctor. Since you're already here, let's just check. That's it. That's all it takes. And suddenly, a healthy, sharp, active 73-year-old who walked in feeling completely fine walks out as a patient, not because something was wrong, not because they felt sick, but because the system found something small, called it a concern, and the treatment for that concern became the actual problem. I've seen this pattern more times than I can count, and it breaks my heart every single time. So tonight, I want to have an honest conversation with you, a real one, the kind your doctor probably doesn't have time for in a 15-minute appointment. We're going to talk about 5 common checkups that deserve a second thought after 70, especially if you feel well right now. This isn't about being anti-doctor. This isn't about skipping care. I want to be crystal clear about that. This is about understanding that the older we get, the smaller the margin for error becomes, and what looks like routine prevention on the surface can quietly become a chain of procedures, complications, and months of difficult recovery underneath. And I don't want that for you. At the end, I'm going to give you 5 simple questions you can bring to any appointment. Questions that slow everything down and put you back in the driver's seat, instead of being swept along by a system that moves fast and rarely looks back. But before we dive in, I have a quick question for you. Have you ever said yes to a routine test without really knowing what would happen if it came back abnormal? Be honest with yourself. Most people haven't even thought about it. If that's you, drop yes in the comments right now. You might be surprised how many people are nodding along with you. All right, let's start with the one idea that ties this whole conversation together: the benefit window problem. Why the math changes. After 70, medicine loves early detection. And honestly, for people in their 40s and 50s, early screening can be genuinely life-saving. But here's what nobody explains clearly enough. After 70, every screening test runs on 2 separate timelines. Timeline A is when the benefits show up. Some screenings only prove their value years down the road, sometimes a full decade later. Timeline B is when the harms show up: false alarms, biopsies, anesthesia reactions, medication side effects, hospital-acquired infections. Those don't wait a decade. Those can happen this week. So the real question, the one worth sitting with, is this: does this test protect my future, or does it put my present at risk? Because here's the thing, most people don't realize until they're already in it. Routine screening is rarely just one event. It's more like stepping onto an escalator. Test arrow, let's just confirm. Arrow, specialist. Arrow, procedure. Arrow, complication. Arrow, new medications. Arrow, new follow-ups. Arrow, more appointments. And once you step on that escalator, it's surprisingly hard to step off. Keep that image in your mind as we go through these 5 checkups. And stay with me, because number 4 is the one that genuinely surprises people. And number 5 is routinely sold as simple, even though what comes after it can be anything but. Test. Let's just confirm. Specialist, procedure, complication, new medications, new follow-ups, more appointments. Checkup. Number 1, carotid artery. Ultrasound. When you have 0 symptoms. Let's start with the one that hides behind the best intentions. A carotid ultrasound looks for narrowing in the large arteries running up your neck, the ones supplying blood to your brain. On the surface, it sounds like smart stroke prevention, right? Here's the problem. For people with no symptoms, no mini strokes, no sudden vision changes, no one-sided weakness, nothing, routine carotid screening is what I'd call a feels smart, performs poorly test. Why? Because mild narrowing in those arteries is genuinely common as we age. Completely common. So when you screen for it routinely, you find it. And then someone looks at you and says, we should probably fix that. The fix, often surgery, something called a carotid endarterectomy. And that surgery carries a real documented risk, roughly a 2 to 3% chance of causing a stroke during or immediately after the procedure. In older adults or those with other health conditions, that number can climb even higher. Think about that for a moment. You walked in feeling perfectly fine. You agreed to a routine scan. And now you're facing a surgery that carries a real chance of causing the exact thing you were trying to prevent. That's not a scare story. That's why the U.S. Preventive Services Task Force officially recommends against routine carotid screening in adults who have no symptoms. So what actually works for stroke prevention after 70? I know it's not as exciting as a scan, but the unglamorous stuff genuinely delivers. Blood pressure control. This is the heavyweight champion. Nothing else comes close. Managing atrial fibrillation if you have it. Not smoking. Staying active. Even just walking daily. Discussing cholesterol and blood sugar with your doctor. Sleep quality. Poor sleep quietly worsens vascular risk in ways most people never connect. And one thing I always say, if you ever experience sudden neurological symptoms, face drooping, arm weakness, slurred speech, sudden vision loss, that is an emergency. Don't wait. Don't Google it. Call 911. That's not screening. That's urgent care. Completely different situation. Checkup number 2, cardiac stress testing. When your heart feels fine. A stress test sounds almost pleasant, doesn't it? Treadmill, some monitors, maybe a little reassurance at the end. But in people without clear symptoms, stress testing has a significant and underappreciated problem: false positives. Depending on the population being tested, false positive rates can reach 40% or higher. That means the test waves a red flag when there's actually nothing wrong. And an abnormal result almost never ends with "don't worry about it." It escalates to a cardiac catheterization, where a tube is threaded through an artery all the way to your heart. That's not a casual next step. Real risks include bleeding, vessel injury, dangerous heart rhythms, and in rare cases, stroke or heart attack from the procedure itself. And if a blockage happens to show up, the conversation often moves toward a stent. Here's the twist that large clinical trials actually confirmed, including something called the ischemia trial. For many people with stable coronary artery disease, stenting provided no significant advantage over good medication management and lifestyle changes in terms of heart attacks or lifespan. So let's trace that path again. I feel completely fine to "let's just check" to "something looks a little off" to invasive procedure to long-term blood thinners to monitoring appointments for years, with no clear evidence that any of it improved the outcome. What to focus on instead? If you're not experiencing warning signs, exertional chest pressure, unexplained breathlessness, fainting, or dramatic changes in exercise tolerance, consider shifting the energy toward blood pressure management, a cholesterol conversation with your doctor, strength training, and daily walking. These are genuinely underrated cardiac medicine, nutrition, protein, fiber, fewer ultra-processed foods, sleep and stress, which quietly drive inflammation in ways we're only beginning to fully understand. After 70, preserving muscle isn't just about looking fit, it is cardiovascular insurance. Full stop. If this video is already shifting the way you think about this, subscribe. I post evidence-based, plain English health breakdowns who want clarity without the fear. Checkup number 3, aggressive cancer screening in low-risk older adults, PSA tests, mammograms. Let me say something important right up front. This section is not anti-screening. Cancer screening saves lives. I believe that completely. But late in life, there is a serious and genuinely under-discussed problem called overdiagnosis. That's when a test finds a cancer that is technically biologically present, but so slow-moving that it would never cause symptoms or shorten your life. Not in 5 years, not in 10, maybe not ever. Modern testing is extraordinarily sensitive. It's essentially like using a high-powered microscope to inspect your entire house for dust. You will find something. The question that matters is, does finding it actually help you? PSA testing, prostate. A slightly elevated PSA can trigger a cascade of anxiety, follow-up appointments, and eventually a biopsy. And if a low-grade cancer is found, it gets labeled cancer. And once something carries the word cancer, the emotional pressure to treat it becomes almost overwhelming, even when that cancer poses little realistic threat to an older man's life. But treatment isn't free. Treatment can bring urinary problems that affect daily life, sexual dysfunction, fatigue, bowel issues, genuine reduction in quality of life, mammography. Similarly, research has found that a meaningful number of breast cancers detected in older women through routine mammography are clinically insignificant, meaning treatment doesn't improve survival, but the side effects of that treatment are completely real. The question that cuts through all the noise if you're older and average risk asks this: if we find something, what would we actually do about it? And would that plan help me live longer or better? Because sometimes the honest, uncomfortable answer is, we'd treat it because it's there, not because evidence clearly shows it improves your outcome. That's not a reason to panic. It's a reason to individualize. Family history, genetic risk, prior diagnoses, current symptoms, these can completely change the equation. This isn't one size fits all. Right now, which fear feels bigger to you? Are you more afraid of missing something serious, or being overtreated for something that didn't need treatment? Comment miss or over. I read every single one, and your answer genuinely shapes what I cover next. Checkup number 4, the bone density scan autopilot. This one surprises people because bone health is real. Falls are devastating. A hip fracture can genuinely change or end a life. So let me be clear, DEXA scans can be useful. The problem isn't the scan. The problem is what often happens automatically afterward. Low bone density shows up, leads to prescription starts, leads to medication, continues for years, and years leads to, and nobody ever really revisits whether it still makes sense. The most commonly prescribed drugs are bisphosphonates, medications like alendronate or risdronate. For high-risk patients, they can absolutely be appropriate, but long-term use has been linked to some rare but serious complications. Atypical femur fractures, unusual thigh bone breaks that can occur with minimal trauma, osteonecrosis of the jaw, bone tissue in the jaw that begins to break down. And here's what genuinely doesn't get said loudly enough in most clinical conversations. For many older adults, the number one fracture prevention tool isn't a pill, it's simply not falling, and fall prevention isn't vague, feel-good advice. It's a real researched program. Strength training, especially legs and hips, balance training, reviewing medications that cause dizziness or lightheadedness, vision checks, home safety, lighting, loose rugs, grab rails, adequate protein and vitamin D, discuss dosing with your doctor. And I want to mention this specifically because it still surprises people. Research suggests Tai Chi can cut fall risk by nearly half. Not a little, nearly half. That's not nice to know. That is a genuinely massive effect. Checkup number 5. Routine colonoscopy. After 75. Everyone thinks they already know this one. Bear with me, because the risk most people focus on isn't actually the biggest one. Colon cancer screening has genuine value. That's not in question. But after a certain age, for average-risk adults with no symptoms and a history of clean prior screenings, the U.S. Preventive Services Task Force recommends against routine colonoscopy after age 75. Not because colon cancer magically stops existing, but because the balance shifts. Complications become more likely, and the benefit becomes smaller and less certain. Most people, when they hear colonoscopy risk, think of perforation. A bowel perforation happens in roughly 1 in 500 procedures. In an older adult, that can mean emergency surgery, a prolonged hospital stay, and a very difficult recovery. But here's the risk that gets almost no attention: the prep. That bowel-clearing preparation before the procedure can cause significant dehydration, dangerous electrolyte imbalances, dizziness, which can lead directly to falls, serious kidney stress in vulnerable patients. Safer alternatives worth asking about. FIT test, a simple annual stool test, no prep, no sedation. Cologuard, stool D, NA testing if appropriate for your situation. If you have red flags, blood in your stool, persistent unexplained changes in bowel habits, unexpected weight loss, that is not routine screening. That is a workup that needs to happen. Please don't avoid it. But if you're symptom-free and average risk, the conversation deserves more nuance than it usually gets. The 5 questions that stop the medical escalator. I promised you practical tools. Here they are. Write these down, screenshot this, send it to someone you love. The next time you're offered any screening test after 70, ask these 5 questions. Calmly, kindly, like you're simply ordering from a menu. Question 1. How often does this test come back abnormal when nothing important is actually wrong, at my age specifically? This opens the false positive conversation. Most patients never have it. Most doctors never bring it up unprompted. Question 2. If something does look abnormal, what happens next? You're not just asking about today's test, you're asking what door today's test opens. Question 3. What are the risks of that next step? Not the test sitting in front of you, the procedure that might follow it. Question 4. What happens if we watch and wait instead of acting right now? Watchful waiting is a completely legitimate medical strategy for many findings in older adults. You're allowed to ask about it. Question 5. What's the most effective, low-risk way to reduce my risk without procedures? Because the honest answer is often better blood pressure control, improved strength and balance, eating to support muscle and vascular health, better sleep, reviewing medications that increase fall risk. A good doctor will respect every single one of these questions. They'll welcome them. If someone rushes you, dismisses you, or makes you feel foolish for asking, that is not a you problem. That is information about them. The real goal isn't more testing. After 70, the win isn't collecting diagnoses like trophies on a shelf. The real win is protecting what actually matters. Your independence, your mobility, your mental clarity, your energy, your ability to live life entirely on your own terms. Sometimes that means doing a test, absolutely. Sometimes it means asking harder questions before you agree to one. And sometimes, after a real conversation with a doctor who actually knows you, it means respectfully declining. The smartest choice is never the one that follows a default checklist. It's the one that matches your body, your real risk, and your actual goals. Now, I genuinely want to hear from you. Have you ever had a just-to-be-safe test quietly turn into weeks or months of appointments, procedures, and worry you never saw coming? Tell your story in the comments, because someone reading right now might be one referral letter away from stepping onto that same escalator. And your experience, your real, honest story, might give them the courage to stop and ask just one better question, and one better question can change everything. If this felt useful, share it with someone over 70 who deserves to hear it, and subscribe if you want more conversations like this one. See you in the next video.